The ceiling now, Laura.
I haven't done it yet.
Okay.
Our lunch is 1 till 2 anyway. Our lunch is 1 till 2, so.
Yeah.
Right, okay, let's go.
We're ready.
We're not live.
Yeah, we are. We're live.
Oh, because it said live.
Yeah.
Okay. Good morning, everybody. Just had a few technical problems. Welcome to our fortnightly webinar through the Devon International Recruitment Alliance. So really exciting today. We're actually going live from the OSCE Training Centre, which is situated at the Nightingale Hospital in Exeter. So Charlotte, one of the OSCE trainers, has very kindly agreed to come and let us observe today. So welcome, Charlotte.
Hello, everybody. Hi there.
So how long have you been teaching OSCE for, Charlotte?
So I've been doing this about 3 months now, so I'm still a new recruit, but I've just started teaching now, which is really rewarding.
Excellent. So I know today you've got a large group of 20 and you're doing the new OSCE training. That's right, isn't it?
That's correct. So we had the legacy training and now this is the new updated training.
Right.
So slightly different, there's different criteria to each department, only very small changes, but it helps with the standardisation across the country so our nurses can be trained appropriately.
Right, and are you enjoying it so far?
Yes, I really enjoy my job. It's lovely seeing other people learn.
Yeah, it's quite rewarding, isn't it?
Yeah, absolutely.
Right, so what I might do, Charlotte, is come back to you a bit later. We're just going to go down and say hello to the candidates.
Yeah, come and see them.
Great, right. Okay, we're just going to walk down now. So this is the Nightingale Hospital. So this is the OSCE Training Centre. Candidates from Royal Devon and Exeter, North Devon Hospital, some from Torbay will come here to do their OSCE training. So as you can see, it's purpose-built OSCE training centre. You've got all the different skill stations here. You can see our candidates practicing hard, one of their scenarios. There we are. That's great. So what we're going to do is we're going to go and observe one of the skill scenarios today. So I know that the candidates have been working hard on the station, which is urinary catheter removal. So one of the groups has kindly volunteered to demonstrate the scenario to us. So I think they're all a little bit nervous, so please bear with them. Let us know if you can't hear. So we're just going to walk down now. You can see they're all practicing hard work. Right, so currently live, all right. So I know that you kindly agreed to do the skill station for urinary catheter removal. So can you just introduce yourselves for us?
I'm Sneha Suresh.
Lovely.
And my name is Lisona Matthews.
Thank you, Lisona.
My name is Stephanie Thomas.
Lovely to meet you. And which hospital are you from?
We are from RD&D Hospital.
That's great. Okay, and you enjoying your OSCE training so far?
Yeah.
Wonderful. So I know it's a 3-week education programme. Is this your 3rd week?
This is our second week.
Second week, right. So you're halfway through at the moment.
Yes.
Right. So who's going to actually run through the scenario and who's going to be watching and marking?
Steffi is going to do the scenario.
That's wonderful. Thank you, Steffi. So if you could speak nice and loudly and clearly so people that are watching can see what you're doing. Don't worry if you get it wrong. We're all here to practice and you're just practicing at the moment. And then I know you two ladies will be going through the OSCE marking criteria, and then afterwards we'll watch you feed back to Steffi. So will you feed back at the end or during the scenario?
At the end.
Right, okay, so we're going to watch you. Please speak up, all right? Thank you, ladies. We'll let you carry on, all right?
Okay. Thank you.
So I've ensured that the scene is safe and approachable. I've closed the windows and curtains to ensure patient privacy and dignity. I'm going to clean my hands following all the steps of hand hygiene. Hello, my name is Steffi and I'll be your nurse for today. How would you like me to call you?
You can call me Craig.
Oh, hello, Craig. Okay, so I'm here to remove your urinary catheter. Are you fine for me to continue?
Yes.
Okay. So just to make sure I've got the right person's prescription here, do you mind if you tell me your full name, please?
Okay. Yeah, my name is Craig David.
And your date of birth?
6/7/1995.
Okay, so I've got Craig David with date of birth 6/7/95. So I'm happy with the right patient.
Yeah.
Do you mind if I just cross check with your ID band?
You can check, please.
Okay. So I've got Craig David with date of birth 6/7/95 and hospital number 123456. So I'm happy with the patient details. So I'm going to get my stuff ready. So I hope you'll be back when I'm here. Okay. So I'll be cleaning my hands again. Getting a pair of apron and gloves. So there's no date of expiry on the apron and gloves. I'll be wearing my pair of gloves because I'll be handling the urinary catheter bag. John, I'll be raising the height of the bed just for ease of access. Are you fine with that? Yeah. Okay. All right. I'll ensure that the catheter bag is empty. If it was not, I would be emptying it first. I'll be placing it on top of the bed, exposing just the part of the tubing of catheter. Okay. I'll get my stuff ready now, disposing of the used gloves. And cleaning my hands again, following all the steps of hand hygiene. So I'm going to get my articles ready. Before that, I'm going to clean my trolley. If I've got Cleanel wipes here, it's clean and intact, and date of expiry is 2026, so I'm happy to use that. I'll be cleaning using 3 wipes. First the top.
Okay.
Then the sides. Closing off that. And the third wipe to clean the bottom shell. My trolley is clean now. Now I'll be getting my articles. I'll be needing a clean into sheet. I'll place it on the bottom trolley and a towel to maintain patient's dignity and privacy. And I'll be needing a 10 ml syringe. So I've got that. I can see that it's intact and it expires on 2025. I'm happy to use that. And a pair of clean gloves. Okay. So I'll be taking the trolley to my patient now. Cleaning my hands again. I'm about to open my syringe to get my articles ready. Ensuring I don't touch the tip of the syringe. Okay. Cleaning hands again. Putting on a clean pair of gloves. Hello, Praise, I'm back. So I'm going to remove your catheter. So I'll be first deflating the balloon. For that, I've got my 10 cc syringe here. So I've aspirated about 6 ml of fluid. So before that, I have to place the towel over the patient to ensure the patient's privacy and dignity. Making sure I don't expose the patient. And place an info sheet underneath him to prevent any urine spills. Assuming I've placed the info sheet underneath him completely, so I'll be aspirating the fluid, withdrawing the fluid after I've done the towel and info sheet. So I've done that. Great. So I'll be removing your catheter now. So I've already checked the site, and since there's no bleeding or discharges, I won't be cleaning that. So John, it might be a bit of discomfort for you when I pull out the catheter. I want you to draw up a nice deep breath. All right, breathe in and breathe out. All right, I want you to do that again. I'm about to remove the catheter. Okay, breathe in. While the patient exhales, I'm going to slowly remove it in a continuous movement. Okay, great. The catheter is out. I'm going to dispose of the catheter in the clinical waste bag. All right. So the catheter has been removed. I'm going to dispose of all my equipment and discard them in the clinical waste bag. Okay. Going to make sure that the patient is nice and comfortable. I need to clean my hands again. All right, great. So you need to make sure you drink about 2 to 3 liters of fluid every day. And it might be a bit uncomfortable for you to pass your urine after we've removed the catheter. So I want you to just ring the call bell when you feel like going for a wee, and one of us will get to you. So because we need to assess if you're passing the right amount. So here's the call bell. You can press the orange button and one of us will get to you. Do you have any other questions or concerns? No? Okay. So are you comfortable like this? Yes. Okay. So I'm going to put the bed down. So thank you for your cooperation. Just let me know if you need anything. And I've got the call bell beside you. I'm done with the procedure and I'll document what I've done and clean my hands.
Definitely, well done. Have you only seen that this morning?
Yeah.
That was fantastic. Well done.
Really good.
Really good.
Well done,
Very
Charlotte.
strong candidate. Right. So, are you going to give some feedback to Steffi?
She have done well, and the only step was like placing the towel above the patient before, withdrawing the fluid from the kidney. So, yeah, but anyway, she has done well. Yeah.
Well done. You can have cake later. Thank you so much. I know you were nervous. That was fantastic, girls. Thank you. Wow. So we've just witnessed urinary catheter removal from Steffi and the ladies. They'd only seen that done once this morning. So I think you'll agree with me, that was exceptional for a first run through. So we're just going to have a further walk down and we're going to go and watch some ladies do the basic life support scenario. So obviously this is one of the skills stations. There are 10 OSCE stations, 4 of which are the APIE, and then there's 6 other ones. So we're just going to go down and find Charlene, who I believe is down on the left. I hope you all enjoyed watching that in the flesh. such a lovely training facility here. So we'll just let these ladies finish. They're just doing a run through of urinary catheter removal, which is a skill that they've been taught this morning. And then I know they're going to go through the basic life support. So please ask any questions you've got in the chat. We have got the rest of the team watching. He'll be able to answer. Remember, we are on social media. We've got Facebook, Twitter, Instagram, and we are new to TikTok. So look out for some TikTok videos. And are you ready, ladies? Give us a like. Give us a love, give us a share on social media. So we'll just hang on for one of the ladies. Give us a share.
So, Ms. Atkins, yeah, I'll just like, I'll give you a call. Can you feel that your discomfort or you're not able to call, can kindly inform us? Or if I'm not available, one of the nurses. Is that okay? Yeah. Yes. I will ensure that I will document whatever I have done for the patient. I've already explained to him the procedure to do what to do after the catheter.
So you can see here watching the scenarios that you have to really verbalise everything you're doing, which does feel a little bit false, but that's what you need to do for your OSCE exam, is verbalise everything. You wouldn't normally do that if it was a bit unnatural, but that's what's required.
5 seconds left. 4 minutes, 25 seconds left. I have 4 minutes, 25 seconds.
Well done.
Thank you.
So, Charlene, we're currently live at the moment, and I know that you kindly volunteered to go through the basic life support
Yes.
skills station.
Yes.
So, Charlene, are you you're at the Royal Devon Exeter, aren't you?
Yes.
And you're on your second week of your OSCE training.
True.
And how are you finding it so far?
The training here is absolutely fantastic.
Yes.
Okay, they're training us like every bit of it,
Yes.
step by step. So we are given lots of training,
Yeah.
lots of practice going on. I really liked it because it kind of each step, like if it's an APIE assessment, they went
Yes.
it step by step.
Yeah.
Assessment, planning, implementation, evaluation, and that was really clear.
Yes.
And we were given loads of practice. At the same time, we are going with the skills part by part. So every day we are practicing 2 skills at a time.
Excellent.
So
So, and it feels very thorough because it's a 3-week program,
Yes.
full time. So you really get this opportunity to keep practicing. And I know they've got a really exceptional teaching team here.
The team is
Lovely Charlotte and Tim.
Keith
yes.
is there around, as well as Shazam. Yeah.
Shazam. So that I know they're fully supportive. So we're going to watch you do the skills station. So basic life support. Would one of you mind taking feedback, and then we will watch you give feedback? Is that okay?
Yeah. The one for the airway as well.
Okay, are you happy to do the airway? Lovely,
She will
right.
give the feedback.
Okay, so we're going to just be here and watch you. Try and speak up, okay, so that we can hear the
Actually, we have a mannequin there.
Oh,
Oh,
perfect.
yeah, you can come over here.
Move stations.
Do you have the CPR?
Yeah,
For the feedback.
Yeah.
So we'll be giving also the feedback, like feedback, how the compressions are going on.
I don't mind doing CPR. If you need me to do CPR,
No, I will do the CPR.
fine. So just explain what you're doing there, Charlene. Is that a piece of software?
Yeah, it's actually a piece of software which is called Cube CPR training.
Yeah.
That's where we place it over the mannequin to get the connection, and
Yes.
so it gives us the real feedback. It's like a feedback device at the rate of compressions that you're giving. It will give you an idea of the rate,
Yeah.
the depth,
Yeah.
as well as the recoil.
Fantastic.
So
Great.
this ensures that you are giving an effective CPR.
Great.
for your
That's it. That's a really good training aid, isn't it?
Yes. I think the mannequin is not selected. Sorry for that.
My arms just get
Yes.
so perfect.
Sometimes they switch off here. Horizontal. Yeah.
So we're just setting up the station now with the software.
So now the software has been
Little
connected.
Annie, there it is.
Yeah, I can just show you a short demo
Yeah.
before we start the whole
Okay.
scenario. So for example, if you are going to give the CPR, so it shows this will be the depth.
Yeah.
This is the recoil.
Great. So that
Okay.
shows you if you're doing effective CPR
CPR.
or not. Yeah.
And also it can also calculate the ventilation.
Yes.
So if there's a good chest rise or not, it will give you an idea.
Fantastic. Great.
So here, you place just a short demo. So just for a trial now. 2, 3, 7,
There we are. Look.
4, 5.
And you see the meter there going up.
10,
There we are.
11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Great. Yeah. That was effective CPR.
Yeah, thank you so much. So this is how all the trainings, when they are doing their CPR, so they are aware that they need to go, because in the OSCE examination, we are assessed based on this.
Fantastic.
So
Lovely.
it's a live demo for us.
Absolutely. And yeah, and it knows if you need to go a little bit harder or less hard. That's great.
So we know where we stand. And
Yes.
Counting the compressions are also very important.
Yes.
So we know the pace at which we are going,
And count out loud.
because the tick here, it shows either if you're going too slow, it will fall down.
Yes.
If you're going too fast, it will go on the opposite side.
Wonderful.
So we
Okay.
need to be in the center.
Yeah.
at all times.
Great. Thank you.
So are we ready for the?
We are ready when you are.
Usually it should show because we have not done the, so at last
Oh,
it
I
gives you.
see.
But the problem here, I think, with the mannequins, they're not getting the effective,
No, the bagging. Yeah.
the bagging.
Yeah.
Like as I said, it will also calculate the ventilation.
Okay, that's good.
So I'll just. The problem is there is no chest rise.
Yeah.
Usually, we usually use the EC clamp technique. So you need to have a proper seal.
Yeah.
Then you just tilt the head slightly,
Yeah.
because it's a mannequin.
Yeah, of course.
Actually, there is a kink here.
Yeah.
So that's why we are not getting the effective chest rise. Usually it should be.
That's
So
fine.
that's the only difference. So you will be at the airway, and you will be the person whom I will call for assistance as well. And you will be the assessor.
Yeah.
Okay.
Great.
Do we need to time ourselves, or that's just?
You can do, yeah, but don't worry too much. It's just to see a rough idea of a run through.
Okay. So would you like to hold this?
I can hold
Yeah. I'll do my best.
it. Okay.
Okay, team ready?
Yes, we are ready.
Okay, assessor ready?
Yeah.
So I'm ensuring that the scene is safe for me to practice. Okay, I'm approaching my patient. He is unconscious at this point. Hello, hello, are you okay?
He's not responding.
So there's no response. Help, someone help. I'm going to press the call bell. There is no help. Okay, when help arrives. Now I'm going to open the airway to check if there is any visual obstructions. I'm looking at the airway, I don't see anything. I'll open it by head tilt, chin lift. Okay, now I'm going to check the breathing and the pulse simultaneously. Look, listen and feel for the breathing and check for the pulse. 1, 2, 3,
He's
4,
not breathing.
5. No breathing, no pulse. Okay, I'll start CPR and wait for my help to arrive. 1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
Effective.
Please, can you call?
Effective compressions.
Can you call the team, please? 222. Okay, and also bring the resuscitation trolley. Kindly please call the team.
Okay. We are calling to the
4,
triple two
5,
for
6,
raise and
7,
report
8,
in
9,
the
10,
recovery room,
11,
and we need
12,
the
13,
resuscitation
14,
team here.
15,
We are
16,
bringing the
17,
resuscitation
18,
trolley here.
20, 21,
I have the
22.
ambu bags.
Do you have the
and
ambu bag?
mask.
Please connect it to 15 liters oxygen.
15-liter
1,
oxygen
2,
connected to
3,
the ambu bag.
4, 5.
And
When
air
you're
is
ready, let
ready.
me know.
Okay, I'm ready.
29, 30.
Okay. Maintaining. Breath 1. Breath 2. Given.
CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 22, 23, 24, 26, 27, 28, 29, 30.
C&E. One breath. Second breath.
CPR.
1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 18, 19, 20, 22, 23, 24, 26, 27, 28, 29, 30.
Help is here. Yes, we have switched the roles.
That
2,
compressions.
3, 4.
1, 6, 7, 8, 9,
Effective compressions.
12, 13, 14, 15, 16, 17, 18, 19, 20, 21,
Effective compression series. Continuous.
30.
2 breaths. 1, 2. Hands on the chest.
1, 2,
Continuous
3,
CPR.
4, 5, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 5, 6, 7, 8, 9, 10.
Okay. 2 breaths. 1, 2. So the scenario is ended. You can ask the questions.
So what would you do now if the patient shows the signs of life?
So if my patient is showing me signs of life, I'll try to put my patient in the recovery position. Okay.
Why might you stop the resuscitation attempt if the patient is showing signs of life?
Why would I?
Stop resuscitation attempt if the patient is showing the signs of
If
life.
he doesn't show, you
Yeah.
mean, okay, if he doesn't show signs of life, I'll wait for the decision from the resuscitation team.
Okay.
Or if it's in danger, then I will.
What are the 4 H's and T's?
Okay, there are 4 H's and T's that can cause cardiac arrest in the patient. So the 4 H's are hypovolemia,
Okay.
hypoxia, hyperkalemia, hypothermia.
Okay, and T's?
But also there are other causes. Usually people don't know. So we can say hydrogen ion acidosis as well, okay, and hypoglycemia. Then we have the next 4 T's. The T's are, it could be because of thrombosis.
Yeah.
Thrombosis could be pulmonary or coronary. It could be cardiac tamponade. It could be tension in the thorax or toxins. So these are the 4 T's.
Okay. How would you maintain the open airway?
As I said, if it is a medical case, you can go with the head tilt, chin lift.
Okay.
Or if it's a trauma case, then we can do the jaw thrust maneuver. Just open the jaw like this. So you can
Yeah,
do the
very
jaw
good.
thrust.
We have done
Very
the
good.
CPR.
Thank you very much. Well done, Charlie. Well done, team. That was great. So that just demonstrated the scenario of basic life support. And you can see the software that is used to show if you're given effective CPR.
Amazing.
Yeah,
Yeah,
really
so
good.
based on this, I guess our score is 74%.
Great.
Yeah, we could have done much more better because the ventilations were not calculating. If that would be there, it would always increase the chances.
It's a really good idea, isn't it, of whether you're given effective CPR?
Yeah, because here it shows that we are having a good chest recoil, which
Yes.
is very, very important
Yeah.
for an effective CPR.
Yeah,
And the depth, we can work on it. So this is how we can give the feedback to our students.
wonderful. Thank you very much for volunteering, and you've earned your cake at break time, all right?
Thank you, guys.
Thank you.
Okay, so we're just going to go back along the corridor now and have a quick chat with Henry. So Henry is one of our nurses that works in North Devon, and he's been here for a couple of months. Now, because Henry knows that he's going to have a short interview, he's dressed very smartly today.
Dressed for the occasion.
Just for the occasion. Henry, are you happy to have a quick chat with the webinar? Don't be nervous, come on. that I'm just saying how smart you look today.
Yes.
Super smart.
So, Henry, tell us when you arrived in Devon.
I came on the 29th of March.
Yeah,
This year.
great. And you're just on your second week of your training at the moment, aren't you?
Second
And
week.
obviously, tell us, how did you find the process coming through the Devon International Recruitment Alliance?
So I saw the link online,
Yeah,
and then I applied for that. I sent in my CV,
yes,
and then I've written my IELTS as of that time,
yeah,
my CBT. So I just submitted that, and within I think 3 days, I had a feedback that I've been booked for an interview.
Yeah.
And I was so amazed because before that I had tried several times on the portal and I was not getting any feedback. So I was extremely happy. By God's grace, after 3 days, I had the interview and I passed the interview, and it took less than let me say 3 weeks me to get my COS. So I was so amazed.
So from interview
Yes.
to COS, that was 3 weeks.
Yes.
So you were very happy with that.
Very, very happy.
Great. And how have you found support? Because we do lots of WhatsApp chats and webinars. How have you found all of that, Henry?
So I think before, even after the interview, I was watching the webinars almost all the time. And that really helped me to even decided to choose North Devon because of I heard about the tourist size, the cool environment and everything. So it helped me to even decide choosing North Devon. And when I came, I wasn't disappointed at all. The
Good.
place is really nice. The people are friendly. And I visited one of the beaches, the and it was nice and lovely.
Oh, you've been to Ilfracombe?
Yes.
Did you see Verity statue?
Yes, I saw that. The place was really nice and
Right.
I'm enjoying the place.
Right. So no regrets.
No regret at all.
Great.
And the place I'm working at APIE, the staffs are very helpful. Our line manager, Jane, has organized some of in-service training for all the new recruits. So she will book and we meet her. So most of the OSCE training we are doing here, she has already introduced us to them. It is really helping us.
Good. And we're hoping that your wife is going to join us very soon, aren't we?
Yes.
Yeah.
My wife is a midwife. Yes, and I'm still in the process. I've contacted them and they're making arrangements for that so that she can join me as soon as possible.
Right. So any advice for anyone thinking of coming to work in Devon?
I think it will be the greatest, how should I put it, thing to do. If you have any other option, I think you should choose you should choose Devon over any other options that you've got, because the support is there. You get help, and I bet you the OSCE you are going to pass because we have the excellence of OSCE trainers. You are definitely going to pass, so you are not going to fail. So I think you should choose Devon. It's going to help you.
Thank you so much, Henry.
All right.
Thank you, Henry.
Right, so really good to catch up with Henry, one of our nurses, who is absolutely loving being in Devon, and that's a really good sort of encouragement from the nurses themselves that have been through our process and are actually here. So we're just going to catch up with Charlotte again, one of the OSCE trainers. Charlotte, thank you. Thank you so much for letting us come and spend time. You've all been wonderful, and the standard of teaching is just incredible. And to see, that skill station after one run through.
Yes.
All the nurses are very happy and feel really supported.
Yes.
Do you have any sort of top tips for international nurses? Because the main concern does be is the OSCE, and they get worried about it before they arrive in Devon. Any top tips in terms of OSCE?
So our main top tips would be, if you have any questions, please just ask. We're here 100% to support you guys. We want you guys to get through. So any questions that you have, any problems, please come to us and we'll answer the questions as best we can. In terms of the actual exam, we'll give you all the information that you'll need to know. There's also additional studies where you can come into the area while you're waiting for the exam. From the end of the training to the start of your exam, you can come and book some time with us in our additional stations that we've got.
Right.
So you can come here on your days off,
Yeah.
and then you can go through scenarios with your colleagues, and we're always around teaching another group. We can
Yes.
pop back and answer questions. So we're always around. You're going to be very, very well supported.
Yeah.
So it's just like they always say, if in doubt, just ask,
Absolutely.
and we'll see what we can do for you.
So even after the 3 weeks is finished, if people want to come back,
Absolutely.
they can
Yep.
do that.
They need to book because obviously we've only got a few stations.
Yeah.
So just to make sure that you get your allotted time, please
Yeah.
book with one of us.
Yeah.
And you can have that time in your own free time, and you can just come here
Yeah.
perhaps as many times as you like. And if you've got any questions,
Yeah.
we're in the same room, so we're able to give you feedback and support.
And it's a real privilege being here this morning, Charlotte.
Thank you.
Because I know this was, this is a Nightingale Hospital that was opened during the peak of the pandemic,
Yes.
which is now being used for lots of different things.
Yeah.
But yeah, it's been a real privilege looking at the facilities and the really good software that you use for the skill scenarios. We'd really like to come back again if you'll have us.
Absolutely, come back again. Yeah.
Right, okay. Right. So we're just going to wrap up there, guys. So we've had a really exciting webinar this morning. We will come back again. We're also planning to visit the OSCE trainers in UHP. So remember, we are at the Nightingale OSCE Training Centre in Exeter. So for candidates that are coming through the Royal Devon and Exeter, North Devon Hospital, and possibly Torbay and South Devon, you will probably come here for your training. They cover quite a lot of the hospitals. University Hospital Plymouth do their own training. So I hope you can see what a fantastic facility we have here for your OSCE training. Please remember to ask us any questions. We've got the group chats. We've heard from Henry, who is loving his experience in Devon, and his wife is going to be arriving shortly. Remember, we're on social media. Give us a like, give us a love, and give us a share. And we will see you all in a couple of weeks. Take care, everybody.
Bye. Oh my God.